Welcome to the deep dive. We are going deep on a topic today that I think is so important and something that a lot of people go through. Understanding conception.
Mm.
For anyone who's on this journey, that it can be a time of like excitement and hope and, big dreams, but also lots of questions. And sometimes it can be pretty overwhelming.
Yeah, absolutely. You're kind of bombarded with information left, right, and center from well-meaning friends to online forums, and it's so hard to sift through and figure out, what's actually accurate and what's just, kind of old wives' tales.
Exactly.
So the stuff that you sent me for this deep dive is super interesting. It's from a fertility network and covers so much ground. It's kind of like a one-stop shop for all things trying to conceive.
Exactly. And that's what we're going to try to do today. Cut through the noise, so to
Mhm.
speak, and pull out the most, helpful, maybe surprising insights to give people some clarity on this whole process. We want to bust some of those stubborn myths and ultimately empower you with some knowledge that you can actually use on your journey.
I love it.
Okay, okay.
Let's dive in.
Let's do it. Starting with lifestyle factors, because it turns out that everyday habits can have a much bigger impact than we might think.
Right. Okay, so let's start with something really basic. Water.
Okay.
The material emphasizes drinking 8 to 10 cups of water a day. And beyond the general health benefits that we all know, this is specifically linked to helping your body flush out waste products,
Mm.
which is always a good thing,
Right.
but also, more specifically for conception.
Mm-hmm.
It helps increase the production of fertile quality cervical fluid.
Oh, interesting. So you're essentially creating like a more hospitable environment for sperm.
Right, exactly. Exactly.
Yeah.
It's all about creating that optimal environment.
Okay. So that's a really good concrete reason to stay hydrated. Now let's talk about alcohol. Here, the guidance is pretty firm.
Mm.
Avoid or strictly limit alcohol if you're trying to conceive. And this isn't just like being extra cautious. It directly impacts fertility for both men and women. Alcohol can affect hormone levels. It can even affect sperm morphology.
Yeah, it's pretty powerful.
Yeah. The Department of Health strongly advises cutting it out completely, both when trying to conceive and obviously during pregnancy.
Yeah. And on that note, let's talk about another thing that people often wonder about:
Yeah.
caffeine. The advice is to limit intake to below 300 milligrams daily. So that's about 4 cups of instant coffee, 3 cups of fresh coffee, or 6 cups of tea, to give you a bit of a visual there.
Okay, that's helpful. So why the limit?
Well, the thinking is that too much caffeine can potentially restrict fetal growth, basically by constricting blood vessels and reducing blood flow to the uterus.
That makes sense in terms of blood flow.
Yeah.
Okay, now onto something that we all know is bad for our health, smoking. But the impact on fertility is pretty stark. The sources we looked at, including a British Medical Association report, say that women who smoke have a 40% lower chance of getting pregnant.
40%.
That's huge.
That is massive.
Yeah. And it's not just women. Smoking also significantly decreases sperm count in men and increases abnormalities in sperm. So things like reduced motility, which is their ability to swim effectively.
Yeah, it's really hindering the little swimmers, isn't it?
Yeah, it's not helping things. The advice here is clear. Seek help if you need to quit smoking.
Totally. Absolutely. Okay, on a more positive note,
Yeah.
let's talk about exercise. Regular physical activity offers a ton of benefits if you're trying to conceive. It helps manage weight, improves your mood, and basically preps your body for the physical demands of pregnancy and childbirth.
Yeah, that all makes sense, but there's a catch, right?
Right. The information cautions against excessive exercise.
Oh, okay.
So basically, pushing your body too hard can disrupt your hormonal balance, and that can lead to fertility problems like irregular periods or even lack of ovulation.
Really?
Yeah, so it's all about finding that sweet spot, not too little, not too much.
So moderation is key.
Exactly.
Yeah.
And speaking of balance, let's talk about stress. This
Yeah.
might seem obvious, but the material really emphasizes that reducing worry can positively influence conception. That intense focus on trying to conceive, sometimes it can actually create a physiological barrier.
It's like the mind-body connection in action,
Yeah,
right?
exactly. Exactly. And there's actually research to back this up. The network's resources cite studies that show how chronic stress can elevate certain hormones that interfere with ovulation and sperm production. So they suggest incorporating relaxation techniques like mindfulness or yoga or just spending time in nature. It's all about finding what works for you to kind of de-stress and unwind.
Yeah.
You know?
But that's really good advice that people can actually apply.
Exactly.
Okay, moving on to something a little bit more tangible. Supplements.
Okay.
The recommendation here is a preconception supplement that contains 400 micrograms of folic acid,
Okay.
all-arginine, vitamin D, and B12. These are specifically highlighted for their role in creating a healthy environment for conception.
And, folic acid is especially important because of its role in the early development of the baby's neural tube. So that's when you really want to make sure you're getting enough of.
Okay, good to know. Now, for some really straightforward practical advice, have sex often.
Yeah.
At least 3 times a week is what they suggest.
Right. It's partly a numbers game, increasing those chances of sperm being there when ovulation occurs.
Makes sense. And here's a low-tech tip that some people might find helpful. Lying down for a few minutes after sex. The idea is that this could help the sperm on their journey.
Oh, yeah. I mean, it can't hurt, right?
Exactly. It's a simple, harmless thing to try.
Exactly.
Okay, another really crucial step they emphasize is getting screened for STDs. Untreated STDs can lead to pelvic inflammatory disease. That's an infection of the female reproductive organs, and it can cause scarring and blockages in the fallopian tubes, which can really impact fertility.
Absolutely. So it's super important to be proactive about getting screened.
Vital for both partners. And along those lines, if you're taking any medications, whether it's prescription or over-the-counter, you really want to talk to your doctor about their safety when you're trying to conceive. The good news is the source says that the pill, antibiotics, or even pain relievers shouldn't affect the accuracy of a pregnancy test.
Right.
So that's something that people sometimes worry about.
Yeah.
But it's reassuring to know that you don't have to, stop everything if you're trying to conceive.
Yeah.
However, they do mention that if you've been on the pill for a long time, there's a chance that your B vitamin levels might be lower. So that might be something to discuss with your doctor in terms of supplementation.
Yeah. Good point.
Okay, and another really practical tip is keeping a menstrual calendar. Tracking your cycle dates, the length of your cycle, any symptoms you experience. This can be really helpful for you and also gives your doctor or midwife a good overview.
Yeah. It's basically creating a visual record that can help identify any patterns or irregularities.
Exactly.
Now, it's also important to have realistic expectations about this whole conception thing.
Yeah.
Even when everything seems perfect, the chances of conceiving in any given cycle are only about 25 to 30%
Yeah.
for a healthy couple.
Yeah.
So patience is key.
It's a good reminder to be kind to yourself during this process.
Mm-hmm.
And finally, in the lifestyle category, a strong warning against crash diets.
Yes.
These can wreak havoc on your hormones and mess with your ovulation.
Yeah. Basically throwing everything off balance and making conception even harder.
Okay. So that covers a lot of lifestyle factors. Now let's shift gears a bit and talk about diet.
Okay.
What should we be eating to maximize our chances?
Well, it's all about creating that optimal internal environment to support conception and a healthy pregnancy. So a well-rounded, balanced diet is essential.
Right. Getting all those essential vitamins and minerals that your body needs, and that will nourish the developing baby. Exactly. And there are some specific nutrients that the material highlights. For folic acid, think leafy green vegetables like spinach and broccoli, fortified cereals, citrus fruits, pulses like lentils and beans.
All those good things. What about iron?
Yeah, iron's important too. Good sources include fortified cereals. Again, lentils, soybeans, dried fruit, and leafy greens make another appearance here.
Okay, good to know. I found this interesting. There's some newer research suggesting that a Mediterranean-style diet might be particularly good for women trying to conceive.
Really?
Yeah. Rich in healthy fats from things like avocados and olive oil, but lighter on dairy and red meat.
Oh, that's fascinating.
It seems to be aligning with a lot of the current nutritional advice we hear about getting those good monounsaturated fats.
Yeah, makes sense.
And speaking of which, they also mention the benefits of monounsaturated fats for conception, specifically those found in peanuts, almonds, cashews.
Yeah.
Good snacks all around. Yeah. And zinc is another one that's really important. You can find it in things like fish, whole grain breads, asparagus, spinach, watercress. Zinc helps support your immune system, and it's also linked to the production of healthy eggs and sperm.
Okay, zinc for the win. And we can't forget about fiber. Incorporating fiber-rich foods like beans and whole grains is also beneficial. It helps with waste removal, which some research suggests might improve conception chances.
Yeah, that makes sense.
Okay, so lots of great dietary advice there. And it all ties back to that supplement recommendation, right? Getting that 400 micrograms of folic acid daily.
Exactly. Diet is important, but that folic acid supplementation is still key.
Okay, now let's tackle some of the myths around conception.
Yes. Let's bust some myths.
Because there's a lot of misinformation out there. First up, the idea that you need to have sex every single day to maximize your chances.
Right. This is the big one.
Does that actually work?
Well, it's not necessarily the best approach. Frequent sex is good, but aiming for every 2 to 3 days is often more effective. Daily sex can actually lead to a lower sperm count for men. And since sperm can survive in the female reproductive tract for up to 5 days, you don't need to go at it every single day to have a good supply of sperm hanging around when ovulation happens.
Yeah, that makes sense. Plus, predicting the exact day of ovulation isn't always easy.
Exactly.
Okay, so myth busted. Next one. Can you get pregnant if you have sex during your period?
The myth is that it's impossible.
Right.
But in reality, it is possible, although less likely. If a woman has a shorter cycle and ovulates early, and remembering that sperm can survive for a few days, sex towards the end of her period could potentially lead to pregnancy if ovulation happens soon after. There's even some research that suggests some women might be fertile as early as day 4 of their cycle.
Wow.
Yeah, so it's not impossible.
Okay. Another common myth is that you can only get pregnant from sex on the exact day of ovulation. Is that true?
No, not really. While the egg is usually only viable for about 12 to 24 hours after it's released, that fertile window is actually much wider thanks to sperm staying power. So conception can happen from sex up to 5 days before ovulation and even a day or two after. So you've got about a week-long window each cycle.
So it's not all about pinpointing that exact day.
Right. It's more about having regular sex within that time
Want
frame.
to take some of the pressure off?
Yeah.
Okay, here's one about menstrual cycles themselves.
Yeah.
Is a normal cycle always 28 days long?
That's a common misconception, probably because of the regularity we see with hormonal birth control. But in reality, cycles vary a lot from woman to woman.
Okay.
The typical range is anywhere from 24 to 36 days.
So there's quite a bit of variation.
Yeah. And even for an individual, cycle length can fluctuate a bit from month to month.
So there's no magic number.
No.
Okay, the next one is a classic. Lying down with your legs raised after sex. Does that help?
Well, it's definitely harmless.
Right.
And a lot of people have tried it, but there's no real scientific evidence to support it.
So if it makes you feel better, go for it.
Exactly.
But don't stress if you don't do it.
No.
Okay, and finally, what about eating oysters to boost fertility?
Ah, yes. The old oyster myth.
Is there any truth to it?
Well, there is a tiny grain of truth.
Okay.
Oysters are a good source of zinc.
Right.
And we know that zinc is important for both male and female fertility. However, just loading up on oysters isn't going to do the trick. It's more about having a generally healthy diet with a variety of nutrients. Zinc, antioxidants, those essential fatty acids found in oily fish.
So it's about the bigger picture.
Right. It's not about one magic food.
And probably avoiding too much caffeine and alcohol, too.
Exactly. Moderation is key.
Okay. Last myth. If you eat well, you don't need to take any supplements when you're trying to conceive. True or false?
Definitely false. Especially when it comes to folic acid. The advice is very clear. All women trying to conceive should take a daily supplement containing 400 micrograms of folic acid and continue this for at least the first 3 months of pregnancy. This is to prevent neural tube defects in the developing baby. And even if you eat a healthy diet, it can be hard to get enough folic acid from food alone.
Right.
So supplementation is really important.
That's good to clear up. Okay, so we've busted some myths. Now let's talk about some general fertility facts, especially as they relate to age,
Okay.
because we know that's a big factor.
Yeah, it is. And it's a fact that more and more women are starting families later in life. The data from the Office of National Statistics shows a clear increase in birth rates for women over 30 since the 80s, and a corresponding decrease for those under 30.
So it's a definite trend. And we know that age affects fertility differently for men and women, right?
Right. Female fertility declines more significantly with age. Women are most fertile in their early to mid-20s, and the likelihood of conceiving naturally decreases as they get older, especially into their 30s and 40s.
Okay.
While male fertility also declines, it's a much more gradual process.
So what's happening in a woman's body as she gets older that affects her fertility?
A few things. The ovarian reserve, which is the number of eggs she has left, decreases over time. And the quality of those eggs also declines. Menstrual cycles can become shorter and more irregular as she approaches menopause. The lining of the womb can become thinner, making it harder for a fertilized egg to implant. Vaginal mucus can also become less sperm-friendly.
Wow, so many changes.
Yeah. And the risk of certain reproductive health conditions like endometriosis and PCOS can increase or worsen with age, which can also affect fertility. And of course, any chronic health conditions can play a role too.
That's a really helpful overview. What about tips for men to support their fertility as they get older?
Okay. Well, avoiding too much alcohol is key, because even moderate amounts can affect sperm count and quality. Interestingly, sperm count might be slightly higher in the morning.
Oh, really?
Yeah, so something to consider. Keeping the testicles cool is also important. So avoiding hot tubs and really hot showers and tight underwear.
Yeah, that makes sense.
And of course, we talked about smoking. Quitting smoking is one of the best things a man can do to improve his sperm health. Diet and supplements also matter. Making sure he's getting enough antioxidants and key nutrients like zinc,
Right.
managing stress and fatigue because these can affect libido and potentially sperm quality. And being mindful of exposure to environmental toxins like pesticides, solvents, lead, radiation. Even moderate drug use like cannabis can have a negative impact on sperm.
Oh, wow. I didn't know that.
Yeah. When it comes to exercise, opting for things like jogging on a treadmill rather than prolonged cycling might be better to avoid heat buildup and pressure in the groin area.
Good tip.
And finally, some research suggests that keeping your mobile phone switched on in your trouser pocket or on your belt might actually decrease sperm count and motility. So that's something to be aware of.
Interesting.
Yep.
Okay, so lots of really good practical advice there.
Yeah.
So as we wrap up this deep dive on conception, what are the key takeaways for our listeners?
Well, I think the main takeaway is that conception is a complex process, but understanding the different factors involved can really empower you on your journey. Lifestyle choices, diet, being aware of common misconceptions, all of these things play a role. And taking proactive steps based on accurate information can make a real difference.
Exactly. Our goal today was to give you some clarity and knowledge to help you navigate this really important time. And on that note, here's a final thought for you. Which of these insights resonated most with you today? Maybe take some time to think about the connection between your own daily habits and your long-term reproductive health. Remember, even seemingly small changes informed by good information can have a really big impact. Thanks for joining us for this deep dive. It's been a pleasure.
I hope you learned something.
Me too.
See you next time.